1. Keep your blood sugar in check every day. Hello everyone! Today's first and most powerful doctor's advice for every diabetic patient is this: control your blood sugar daily. Diabetes management starts and ends with understanding your blood glucose. When your sugar is too high, it damages blood vessels, nerves, kidneys, and eyes silently over time. That's why doctors emphasize daily monitoring. Check your fasting sugar in the morning and your post-meal sugar 2 hours after eating. The goal for most people fasting between 80 and 130 mg/dL and after meals below 180 mg/dL. If your readings are higher, it's a signal to adjust your diet or medication, not to panic but to act smart. Avoid sugary foods, white bread, desserts, and processed snacks. Choose whole grains, brown rice, beans, vegetables, and lean proteins. Combine fiber, protein, and healthy fats to slow glucose absorption. Exercise for 30 minutes a day. Brisk walking, cycling, yoga, or even dancing. Anything that moves your body helps your insulin work better. Finally, keep track of your A1C level, which shows your 3-month sugar average. The target is below 7% unless your doctor sets another goal. Remember, diabetes doesn't control you. You control diabetes through awareness, balance, and daily discipline. 2. Eat like a doctor prescribes. Smart, balanced, and planned. Your diet is your daily medicine. Doctors often say, if you eat right, a diabetic-friendly diet isn't about starving, it's about stabilizing. Follow the plate method. Half your plate, green vegetables, spinach, bitter gourd, cucumber, broccoli. 1/4 lean proteins, chicken, fish, lentils, tofu. 1/4 complex carbs, oats, brown rice, whole wheat, sweet potato. Avoid sugary drinks, fruit juices, white rice, and bakery items. Instead, snack on nuts, seeds, or low sugar fruits like apples and berries. Eat small. Frequent meals every 3 to 4 hours to prevent sugar spikes and crashes. Don't skip breakfast. Include fiber and healthy fats like olive oil, avocado, and flax seeds. These improve insulin sensitivity and keep you full longer. And most importantly, drink water regularly. Dehydration can raise your sugar levels. Food can heal or harm. Choose healing food. Plan your plate, stay consistent, and make every bite count. 3. Stay physically active. Movement is medicine. Doctors say sitting is the new smoking. For diabetics, this couldn't be truer. Exercise is the most natural insulin booster your body has. It helps glucose enter your cells and lowers your sugar naturally. You don't need a gym. Just 30 minutes of brisk walking 5 days a week can transform your health. Add stretching, light strength training, or yoga for flexibility. Start slow. Even 10 minutes after every meal helps control post-meal sugar. Physical activity also reduces stress, lowers blood pressure, and keeps your heart strong. Crucial for diabetics who are more prone to heart disease. Make it a habit, not a task. Choose something you enjoy, dancing, gardening, or cycling. The goal isn't perfection, it's consistency. Remember, medicines control diabetes, but movement can reverse it. 4. Manage stress before it manages you. Stress raises your blood sugar. When you're anxious or angry, your body releases cortisol and adrenaline, hormones that increase glucose. That's why doctors remind patients to care for their mind as much as their body. Practice deep breathing, meditation, or prayer for 10 minutes daily. Sleep well. Talk to loved ones or join support groups. Emotional stability is part of treatment. Avoid overthinking, arguments, or burnout. Chronic stress weakens your immune system and worsens diabetes complications. Make peace a part of your prescription because your mental health directly affects your physical health. 5. Never skip your medication or doctor visits. Your medicine and doctor checkups are your safety net. Never skip them, even when you feel fine. High diabetes can be silent. Your doctor adjusts doses based on your readings and lifestyle. Missing tablets or insulin can cause sugar spikes and long-term damage. Always carry your prescription. Keep your insulin stored properly. Take medicines on time before or after meals as advised. Have a full diabetes review every 3 to 6 months. Blood sugar, A1C, kidney function, eye exam, and foot check. Prevention is better than cure. Trust your doctor, follow your plan, and never stop medication without consultation. 6. Take care of your feet. Every step matters. Foot problems are common in diabetics due to nerve damage and poor circulation. Doctors always say, check your feet daily. Wash and dry them carefully. Keep nails trim and never walk barefoot. If you notice cuts, swelling, or dark spots, see your doctor immediately. Wear comfortable shoes with soft soles. High moisturize, but avoid lotion between toes. A small blister can turn into a serious infection if ignored. Protect your feet. They carry you through life. 7. Prioritize sleep. Your body's natural healer. Sleep is not luxury, it's therapy. Lack of sleep raises blood sugar, increases hunger hormones, and worsens insulin resistance. Aim for 78 hours of good sleep daily. Avoid screens before bed, caffeine at night, and heavy dinners. Go to bed and wake up at the same time. A calm, Rested body manages glucose better than a tired one. 8. Drink plenty of water. Stay hydrated. Stay healthy. Dehydration thickens your blood and raises sugar levels. Doctors recommend 8-10 glasses of water daily. Avoid soft drinks, juices, or energy drinks. They're loaded with sugar. Choose plain water, herbal teas, or infused water with lemon or mint. Hydration helps kidneys flush excess sugar and supports your metabolism. 9. Maintain a healthy weight. Losing even 5-10% of your weight can dramatically improve blood sugar control and reduce medication needs. Eat smaller portions, avoid fried food, and increase daily activity. And weight control lowers cholesterol and prevents heart disease, a major diabetic risk. Your goal isn't to be skinny, it's to be healthy and strong. 10. Regular checkups. Prevention is your power. See your doctor regularly, not just when something's wrong. Routine tests catch complications early. Check blood sugar and A1C, blood pressure, cholesterol, kidney and liver function, eye and foot exams. Stay informed about your health. Knowledge is your protection. Monitor blood pressure regularly. High blood pressure and diabetes often go hand in hand. Keep your BP under 130/80 mmHg. Uncontrolled pressure damages kidneys, eyes, and the heart faster in diabetics. Use a home BP monitor and record readings weekly. Limit salt, avoid stress, and stay active. Watch your cholesterol levels. Diabetics are at high risk for heart attacks. Ask your doctor to check your lipid profile every 6-12 months. Focus on lowering LDLs, bad cholesterol, and raising HDLs, good cholesterol. Avoid fried foods and red meat. Eat more fish, oats, and nuts. Protect your eyes. Get annual eye exams. Diabetes can damage tiny blood vessels in the eyes. Nurse and leading diabetic retinopathy. See an eye specialist once a year, even if you see perfectly well. Early detection can prevent blindness. Take care of your kidneys. Your kidneys filter toxins, but diabetes can silently harm them. First, get urine microalbumin and creatinine tests yearly. Drink enough water. Control sugar and BP and avoid unnecessary painkillers. They strain the kidneys. Get vaccinated. Diabetes weakens immunity. Doctors recommend yearly flu shots, pneumonia vaccines, and hepatitis B protection. These simple vaccines prevent serious infections that diabetics are more prone to. Don't ignore foot numbness or tingling. If you feel tingling, burning, or numbness in your feet, it may indicate neuropathy. Don't ignore it. Get checked early. Use comfortable footwear and protect your feet from injury. Avoid smoking. Completely smoking narrows blood vessels, increases BP, and worsens insulin resistance. It's one of the fastest ways to develop heart and kidney disease and diabetes. If you smoke, stop now. Ask your doctor about nicotine replacement or counseling. Limit alcohol. Alcohol can cause sugar fluctuations, both highs and dangerous lows. If you drink, do so only occasionally with food and know your limits. Avoid sweet cocktails and beer. Manage dental health. Diabetes increases risk of gum infections and tooth decay. Brush twice daily. Floss and visit a dentist every 6 months. Healthy gums help you control sugar better. Take vitamin D and B12 checks. Many diabetics, especially those on metformin, develop vitamin B12 deficiency, causing fatigue or nerve pain. Ask your doctor to test your levels yearly. Saying vitamin D also helps insulin function. Get morning sunlight or supplements if needed. Learn to read nutrition labels. Doctors often find patients eating sugar-free snacks loaded with carbs. Always check total carbohydrates and hidden sugars like fructose, maltose, corn syrup. A sugar-free label doesn't always mean diabetic friendly. Keep an emergency sugar source if you're on insulin or tablets that lower sugar. Always carry a glucose tablet or candy. If you feel dizzy, shaky, or sweaty, it could be low blood sugar. Take one candy and rest, then check your glucose. Avoid self-medication or herbal course. Many natural diabetes cures online are unsafe. Never stop prescribed medicines for unverified remedies. Some herbs can damage the liver or kidneys when mixed with diabetes drugs. Always consult your doctor first. Regular exercise variety. Change your activity routine. Combine aerobic exercise, walking, swimming, and strength training. Building muscle improves insulin sensitivity and burns glucose even at rest. Build a support system. Having diabetes can be emotionally tiring. Join a diabetes education program or support group. Talking to others helps you stay motivated and consistent. A bonus doctor's reminder: diabetes is 80% self-managed and 20% medically managed. Your doctor can guide you, but your everyday choices are your medicine. Check your sugar, eat clean, move daily, and live with awareness.